Hi friends, welcome to my channel, and today we're going to discuss about 5 things that you can do to prevent or treat carpal tunnel syndrome. The first thing that I would like to tell you for managing carpal tunnel syndrome is wearing a splint at night. So using a wrist splint at night is one of the most useful things that you can do to alleviate your symptoms. Right? So what is the basic thing that causes carpal tunnel syndrome? When your wrist goes into flexion like this inadvertently happens during your sleep, and therefore you have these symptoms in the night and you have to get up and shake your hands. So therefore, to avoid these symptoms occurring in the night and to prevent these disabling problems in the night, you can wear the splint at night. So wear it in both hands when you have bilateral carpal tunnel syndrome, and make sure you don't have these recurring symptoms in the night that wake you up. So the first tip that I would like to give you is please wear a wrist splint at night. The second tip that I give most of my patients is to do warm water or hot water soaks. So take a mug of warm water and soak your hand up to the wrist or beyond the wrist, and gently exercise your hand in the water for about 10 minutes thrice a day. So if you have very severe symptoms, it is better to do it thrice a day. If you have milder symptoms, maybe twice a day, once as soon as you get up, because your hands are very stiff in the morning and before you go to sleep. So when you do this warm water soaks, it makes a huge difference in managing carpal tunnel syndrome. The third thing that you can do is something called as nerve gliding exercises. There are 6 steps to the nerve gliding exercises. Nerve gliding makes the median nerve in the carpal tunnel more free. The first step is make a fist like this. The second step is straighten it out completely like this. The third step is move the fingers or extend the fingers, the thumb along with the other fingers. The next step is extend the thumb out like this. So you extend the thumb out like this. The fifth step is you bring the palm and face the palm to the wall. This is the fifth step. The sixth step is hyperextend the thumb with your opposite hand. So the 6 steps are: first make a fist, straighten it out, all the fingers out and keep the wrist in neutral position. Then extend the wrist with the thumb along with the other fingers. Then you turn the palm towards the ceiling. Then you extend the thumb, number 6, and then you push the thumb or hyperextend the thumb. So these are the 6 stages of a nerve gliding exercise for median nerve or carpal tunnel compression. You should do this about 10 times in the morning, 10 times in the night, and this will also help in the free gliding of the median nerve in the carpal tunnel and may relieve some compression symptoms. So what is the fourth tip that I would like to give you? This is very important for people who are on the laptop or on the computer for a long duration of time. If you're on a laptop for more than half an hour or you're typing away in a laptop, please do not use the keyboard in the laptop, because you're typing in a very concise or small space. Your wrist is flexed, which is a main trigger for your carpal tunnel syndrome, and you're typing in a very confined space. So this kind of activates or increases the pressure and causes carpal tunnel syndrome. So please do not use a keyboard in the laptop, right? Always use an external keyboard or a desktop keyboard, which will help you place your hands like this, a little more in wrist extension, and then you can type like this within a more wider space, and these reduces your symptoms. The fifth thing that can help you very much in carpal tunnel syndrome is getting a steroid shot. It's a very low dose steroid. A lot of patients are very apprehensive about this. It's called triamcinolone. It's a very low dose steroid. It is given in a very local area of 1 centimeter here, and it's a local injection. So therefore, when it is given there, it reduces the inflammation and swelling. It gives dramatic results to more than 70 to 80% of patients. And many patients have permanent recovery as well after a cortisone shot. However, this cannot be used in very severe carpal tunnel syndromes, but can be used in mild to moderate carpal tunnel syndrome. So the 5 tips that I gave you today, or the 5 things that could help you with carpal tunnel syndrome, is: one is use a wrist splint at night. Second is warm water soaks. Third is nerve gliding exercises. Fourth is use an external keyboard. And fifth is, if all else fails, use a cortisone injection or a steroid shot. So those are the 5 tips that are 5 things that would help you with carpal tunnel syndrome. I hope this video helped you. Please do get in touch with me if you need any further help. Thank you very much. This is Dr. Kanan Kumar. Thank you.